Meanwhile, about 170 indigent patients have received surgical and medical intervention through the OGUN State Medical Mission and the Ajose Foundation, the pet project of the wife of the state governor, Bamidele Abiodun. Speaking during a visit to the Olabisi Onabanjo Teaching Hospital, venue of the interventions, the First Lady says indigent residents are being targeted in order to reduce the financial burdens and ensure quality health care. Details in this report.
The yearly medical and surgical interventions is geared towards provision of quality health services, especially indigent members of the society who continue to suffer in silence under exorbitant financial medical expenses. About 170 residents under this category were selected and are being given medical attention according to their needs by United States-based surgeons, physicians, with the First Lady at hand to give a moral support.
Also, they have equipment here that were not available in the other place that they were using, so it's made things more efficient. People who are not able to afford surgeries, we have people who have things that we may consider minor, like hernias, like fibroids. We've taken out some giant fibroids. There was one I saw when we went into the ER and into the operating room. People with goiter, thyroid issues, people with basic, not really basic, but surgeries that can be done quickly. But people who cannot afford to pay for their surgeries. Well, so far we've done, this is day 2, and as at last count, they've done 51 surgeries. So by the end of today, I don't know how many we would have done, and which is incredible.
The medical mission also attracted the unveiling of a brand new endoscopic machine by the First Lady and development partners for early detection of cancer, endoscopy, and therapeutic procedures.
Not only that machine is to prevent anything, there's upper GI, any ailments from your mouth, from when you put your food in there to go into the stomach, they will detect any abnormalities instantly. It's a video camera. Just like the video, you just put the tube in there, you will see any kind of erosions that go into your stomach. So we just trained one nurse. Within about 30 minutes, that nurse was able to use the machine to take care of 5 patients. So by today now, she already trained another nurse to do the same thing. So it's not just the machine, it's just service transfer, capacity building. So we had to just teach other people to do the same thing. And that's what we just did. So 3 nurses already know how to use it. They don't need us no more. And the machine.
While appreciating the gesture, the Chief Medical Director of the state-owned teaching hospital says this will greatly help in effective diagnosis and treatment of many diseases.
This is an added value, an additional service. Though we'd initially started some few months ago, but we're hampered by our own equipment. We're working on loaned equipment. And it is going to be doing gastroscopy, upper GI endoscopy, and lower GI endoscopy. It's called colonoscopy. Now, there are some silent cancers, particularly colon cancer, which have symptoms that are similar to just any other general diarrhea or constipation, change in bowel movement, that people would not know that it's cancer growing. And it's one of the cancers that can actually be cured completely if it's detected early. So we are really happy. We've been longing for this equipment, and we are happy that it has eventually landed. And we say a big thank you to all our donors, for those who have contributed to this, to make this happen. And so we can also gladly say that we do endoscopic diagnostic and also therapeutic procedures here, gladly.
And for unwavering support for the tertiary teaching hospital every year, the hospital management presented to her a plaque to appreciate a gesture for development of the hospital.